Hi, my name is Dan Schumeyer, President of Ear Technology Corporation, and also I'm involved in dispensing hearing aids. As a matter of fact, I've been dispensing hearing aids since 1973, before it was really fashionable with many of the organizations. Today I'd like to welcome you to BYOB, which is not bring your own bottle unless you're at home, but this stands for Boost Your Own Business. And today I'd like to give you some clues, as I will with further information I'm presenting it weekly, about how you can boost your own business, where you can make more profit and it can be beneficial to you. First topic is going to be cerumen, and as you know, cerumen is a naturally occurring, normally extruded product of the external ear canal. Usually it's very asymptomatic, doesn't cause any problems. However, when it does get impacted, it can cause complications such as hearing loss, pain, or even dizziness. Now, there are three treatment options for removing cerumen, impacted cerumen. One is a manual removal with curettes. The other is the use of cerumenolytic agents, and the other is irrigation. Now, you should remember from your anatomy that the external ear canal is innervated by the auricular branch of the vagus nerve. When you're removing cerumen, coughing or even cardiac depression can accompany stimulation of the canal from cerumen impaction or removal attempts. One should know that 10% of children have impacted cerumen, about 5% of normal healthy adults, young adults, but up to 57% of older patients in nursing homes have impacted cerumen. And this even increases when people use cotton swabs, hearing aids, earplug type hearing protectors, also increase the incidence of impacted cerumen. In my opinion, always referring someone from your practice to a physician to have cerumen removed is probably not the right way to go. I think it reduces the confidence that your patients have in your practice. So I think you need to see if you can do this procedure in the office. It's not very hard to do. And what you need to do is check to see if it's within the scope of practice within your state. If not, courses are available at many of the trade shows and also the professional training seminars to teach you about cerumen removal. What I'd like to do next is we're going to go to one of my examining rooms, and I'm going to show you different procedures for manual removal, different types of irrigation, a type of irrigation that I think is important, and also about some of the cerumenolytic agents that can be helpful. As I mentioned, there are three ways really to remove the cerumen from the ear. And let me talk first about manual removal. And the easy way to do that is, of course, you want to visualize the ear canal first with your otoscope to see where the wax is. And then the use of a curette is the easiest way to remove the wax. In the olden days, we used to have just the metal curettes that we would use, but now we've got curettes that are lit. Let me show you one of these here. This is a curette that's called Light Beam. It's got a light source that's rechargeable. It's fiber optic, and what you can simply do when you're removing wax from the ear is pull the ear up, reach inside, and pull the wax out. Now, I normally have a tissue with me when I'm doing that. So as I remove the wax, I simply wipe the curette off. Occasionally the wax is so hard that you'll have difficulty removing it with the curette alone. In that case, sometimes I ask people to use something like Debrox or mineral oil or even baby oil, if they can put a few drops in their ear for maybe 2 or 3 nights before I would remove it the next time. And that softens the wax, and then it would come out easily. Another way that you can remove the wax from the ear instead of a curette is with a product called the irrigator. I think the irrigator is a tremendous product. It was developed by an ear, nose, and throat physician. And what the irrigator does, it will actually deliver water to the ear canal. We generally ask the patient to hold a trough like this. We know where the wax is, and then we can pull the trigger here. And when we pull the trigger, we can pulse the water or we can turn it on so it's a little stronger stream. This device is designed so that the water is at body temperature, so you don't get a caloric effect of the person getting dizzy. The water goes into this large container here, and the wax will generally fall right in there. This is a very, very nice product. We've got one in all our offices. It just makes it so much nicer to be able to remove the wax from the ear canal. So the use of a curette, and I might mention you might want to look at Light Beam. Light Beam is the newest product on the market as far as lighted curettes. We've got a number of curettes in the package, different sizes that can be reordered. It has a base for the rechargeable portion, and it works great. Today I've just touched very briefly on cerumen impaction and methods for removal. For a great article about cerumen impaction, the diagnosis and management, look at the American Family Physician article that we've listed below. I think you'll find it's a great reference for you to have. I hope you enjoyed today's session. If you like it, tell one of your audiological friends. If you didn't, have a good day.